Greetings. Hello, my name is Rod Thompson. Welcome to Roadmap to Medicare, the Medicare 101 education event. What we're going to do is make Medicare easy for you, what it is, what it does cover, what it will cost, ABCs of original Medicare. We're going to explain the parts and how each part works. Your Medicare options, there's a lot of Medicare options. It's confusing sometimes, but we're going to try to make it easy for you. We'll go over the Medicare Supplements, the Advantage plans, and the drug plans. And then we'll go through how to select the right plan based on your needs, your budget. And we'll do an unbiased report for you that helps you. We're going to go over how to pay less and get more and compare the plans side by side and know what to look for. That's something that we do using our computers. And you're also going to know when it's time to change because it's different for each individual. And yearly is the time to do a review. So hopefully you won't be going through this. You'll be able to find an easy guide that we've done for you. What is Medicare? It's health insurance. It's a federal program started in 1965 during the Johnson administration. The Centers for Medicare and Medicaid Services is called CMS, Centers for Medicare and Medicaid Services. They are running the show. It's financed by your payroll taxes, so you paid for it. And monthly premiums, which you pay for monthly. Now, people who are eligible are anybody over 65 or anybody under 65 with certain disabilities. And you know who you are. If you have those certain disabilities, you've been on Social Security, SSI, disability. And if you've been on it for more than 24 months, then you can move to Medicare. Also, no matter what age you are, end-stage renal disease qualifies you for Medicare. There are four parts. There's the hospital part, the medical part, the Medicare Advantage part, and the prescription part. Those are the four parts to Medicare. Original Medicare started out with Part A and Part B. Part A is hospital insurance, and Part B is medical insurance. Original Medicare pays for inpatient care, skilled nursing care, home health care, and hospice care. That's Part A. Part A is free. It comes to you free. There is no premium. You paid for it during all those years when you were working. So it's the hospital insurance portion of your Medicare. You have to have worked at least 10 years to earn the required credits. Original Medicare costs, if you do check into the hospital, Part A has a deductible of $1,408, which you will be charged the first day that you go into the hospital. So that kind of sucks, $1,400 from day one. And then if you check out of the hospital and you're out of the hospital for 60 days and you check back in again, that's another $1,400 that you have to pay in deductibles. So there's some strategies to avoid that, so don't freak out. Original Medicare costs are Part A, and the co-insurance varies. Your share of the cost after the deductible, usually a percentage of the total cost. So once again, we're talking about Part A, the hospital part. The original premium on Medicare costs is $144.60. That's for Part B, medical insurance. That's everything except your hospital insurance. It's paid through a deduction from your Social Security, or you can pay it directly. That's up to you. $144.60 per month. Now, the deductible on Medicare on your Part B is $198 a year. Trust me, you have never in your entire insurance life had a deductible of $198. That is chump change compared to what you're used to paying in the private system. Your co-insurance, the part that you pay for with Medicare, is 20%. So your Part B, you pay for. Your Part A, you don't have to pay for. Your Part A has a $1,400 deductible, and the Part B has a $20 copay plus the deductible, which is $198. Original Medicare pays for doctor service, lab tests, x-rays, outpatient care, a lot of preventive services, and some other services and supplies. That's Original Medicare Part B. Medicare, however, does not pay all the healthcare costs. So what you need is some way to handle the other costs that Medicare doesn't pay, like that big $1,400 deductible I told you about, and of course the copays, the 20%. You don't want to have to pay that yourself. So the way to handle that is to get a separate insurance policy called a Medicare Supplement or Medigap. The coverage levels vary by plan, and the plans are uniform. They are plans A through N, and they are identical plans no matter who you buy them from. So don't let anybody tell you that their plan is better than anyone else's. A plan A is a plan A. A plan G is a plan G, period. The only difference is how much you pay. Medicare supplements are standardized, and this has happened in 1982 by Congress. It makes for a much easier price comparison. The plan benefits are identical. Like I said, plans A through N are absolutely identical, and the plan premiums differ as well, but the plan premiums differ from carrier to carrier. Now, the Medicare supplements were modified in 2010 to eliminate duplicate and rarely used benefits, and it created cost-sharing plans. So for those of you that want to do a very high deductible and you're very well off financially, those plans are available. Plan N has a high deductible. But the plan most people gravitate toward, and I can tell you this because the most people that I've signed up and that my partner has signed up, is Plan G. He signed up over 3,500 people. So Plan G is definitely the most popular. It pays everything except that Part B deductible. Remember what that was? $198. So Medicare Supplement Plan G is definitely the plan that you don't have to worry much. There's not a lot of worry because it basically pays for everything other than the deductible. Plan F and Plan G, Plan F is no longer available, so we don't even have to fool with that. Now, the Medicare supplements, any doctor or facility nationwide, if they take Medicare, they have to take the Medicare supplement. So you don't have to worry about networks or PPOs or HMOs or any of that stuff that you used to have to worry about. You just don't worry about it. It's priced by area or it's age rated, and it's guaranteed renewable. Now, that means that your coverage cannot be terminated by the insurance company unless you commit fraud or you don't pay your premiums. And most of you are not going to commit fraud, and most of you are going to pay your premiums because you'll want it to be deducted automatically so you don't worry about it. Medicare supplements, they're the most, you have to qualify and be healthy enough to get a Medicare supplements unless you're just now aging into Medicare for the first time. So that means they pretty much have to take you, no matter what your health is, this one time when you're 65 years old and you're aging in. As you get older, you will find that you have to pass the health questions in order to enroll in a different Medicare supplement plan. So the time to get a Medicare supplement plan is right now when they cannot reject you for health reasons. How to select the right plan? Well, what we do is we take information from you. You'll see the little piece of paper that we ask for information on. You'll fill that out, and that allows us to go through and do a computer-based unbiased guide. Since we are not captive agents, we do not have any dog in the hunt. We don't care what kind of plan you get. We get paid the same pretty much no matter what. We also do not take incentives from the carriers. They sometimes bonus people an extra $200 for signing them up to this plan or that. We have found that to not be good for the customer. So we do not take part in those kind of bonuses that pay us bonuses. We are going to compare all Medicare supplements for you. That's what we do. Now, the overview is this. You end up with Medicare Part A, which remember, that's free. Part B, which you pay $150 for. $144.60, and then the Medicare supplement or the gap coverage. So that's pretty much covers all of your healthcare costs. But you know, we haven't even started talking about your drug costs. And that's a big bag of worms. That's Medicare prescriptions or Part D. The Medicare prescription Part D is also run by private companies. You must already have a Plan A or B, or you must be eligible for Plan B. And you have to enroll during the annual enrollment periods, October 15th to December 7th. Of course, that doesn't come into play if you're just now aging into Medicare. You can get it when you first age into Medicare. The prescription drug coverage also carries a late enrollment penalty. Trust me, you don't want to get a late enrollment penalty because it's only 1% of the national average premium added on, but it's added on monthly and it can add up really quickly. So don't make the mistake of not getting the prescription drug coverage. You can get the cheapest drug plan out there. There's no reason not to get a prescription drug coverage when you age into Medicare, because it's very few dollars. In many cases, less than $15 a month. Now, the prescription drug coverage varies wildly, and the costs change, and they change yearly. So it's best to get help figuring out what's going to be the best plan for you based on your particular medications that you take. So once again, we use your medication, your list of medications, to run a personal evaluation for you, an unbiased plan data, and we compare all drug plans. This is not in this meeting. This meeting is just information. So we will not be able to take your information and do anything with it during this meeting. The overview on this now you have a full page. You have Medicare Part A, you've gotten that. When you aged into Medicare, it was free. You got Part B, which is that $146.50 a month. You got the Medicare Supplement, which is the gap coverage, and you got your Part D prescription drug plan. So that's one way of covering yourself. That's one way of doing Medicare. Now, let's talk about a different way to do Medicare. It's called Medicare Advantage or Part C. Now, Medicare Advantage or Part C takes you completely out of the Medicare system, and it is run by healthcare companies, HMOs and PPOs, and you know all the rules. You have to go to the right provider and all that good stuff. So it replaces original Medicare. It is run by HMOs, PPOs, and private fee-for-services. The Medicare Advantage Part C is really a great advantage for somebody who's low income, because in many cases, there's a very low premium, and in some cases, a $0 premium. But with Medicare Advantage, you must use certain providers. The providers can accept you on a case-by-case basis. The benefits change yearly, and the plans do discontinue occasionally. They're also referred to, Part C, of course, is also referred to an HMO fee-for-service or Medicare health plan. Now, there's one really good thing about Medicare Part C, and that is that it includes your Part D coverage. So with a Medicare Part C, there's only one card you need. It's that one Part C card. And you show that whenever you go for your drugs or for a doctor or for a hospital. In summary now, original Medicare or Medicare Advantage, you can't have both. You get either one or the other. So here's what it looks like. On the left is Medicare Supplements. That's the monthly plan. It pays all of the deductibles and copays except for the yearly $198 deductible. And your Part D prescription drug plan, once again, you pick that based on your drugs. When we do analysis of the drugs that you currently use, we can give you some suggestions on which companies to go with on Part D. If you go with Part C, you got to remember it completely replaces original Medicare. Now you're responsible for 20% of all of your Part B. That's the disadvantage. The other thing about Medicare Part C is they do protect you with what's called a maximum out of pocket, but only certain things qualify under the maximum out of pocket. So the way I tell people this is if you can afford the left side here, Medicare plus a supplement, you're in a much safer position than if you get Medicare Part C, because you're liable for a lot more costs of Medicare Part C. Once again, Part C is pretty good if you're on low income, because with Part C, often you can get what's called a D-SNP, which is a different kind of, it's a Medicare Part C that is paid for by your Medicaid. So if you have Medicaid, this is a great way to go, Part C. So what's next? Well, you fill out that little card. We run your personal evaluation. We compare all the drug plans, and we compare all the Medicare supplements and all the Medicare Advantage plans. And then we have unbiased plan data that we go over with you. So please, if you haven't already done it, put our phone number in your phone and our name, Rod Thompson, or just put Medicare 101, whatever you want to do. But that way, when the call comes, you'll answer and you won't dodge the call. It's really important that you answer the call. We have to talk to you in order to ask you questions and go over our unbiased plan data with you. So please do us the courtesy of answering the call when we call. If you don't, we will leave a message and then you can call us right back. So don't forget, turn in your sheet. And if you're watching this on the internet, there is an electronic form for you to fill out. And thanks for taking the time. Have a great day.